The day started with a brief history of urban health. After, the delegates had a marathon of activities. In highlight, 2 oral sessions. The subject of the first one were the urban disasters and how to plan for dealing with them.
Disasters don't really give you an advance warning. So once you have a disaster, if you don't have a plan, you're not going to be ready to tackle the various issues that come with disasters. And we just had a big disaster in Japan, and the Japanese government is very prepared for an earthquake. But having a tsunami and a nuclear disaster after that is something that even a country like Japan, which is so advanced in looking at that work, was finding it difficult to look at. So it's very important to plan for disasters, because that's the best way you'll be able to take action when the time comes.
The other one is about drugs and health problems caused by them.
Now, 60 years of drug war, and see how it is. More and more drugs, it doesn't work. So what we have to do is helping people to stay in good health, trying to help them not to have HIV infections or HCV, not to die from overdose, and to help them staying in the better social health possible too.
Spread in the saloon an exhibition with the oral poster. In these sections, participants could talk with professionals from different places about social programs developed by them.
I think oral posters are very important in a conference because it enables people to walk around and see a snapshot of the many things that are going on around the world in urban health and get a chance to really talk to the presenter.
We have tested number of interventions in this project, and we wanted to share these projects with other agencies who are working on urban slums, urban health. So we have come in this conference to share our own experiences, our own strategies with other people, and to know how other people, other agencies, they are working, and what are the successful models which we can go and implement in our project.
Also, the workshop started in the second day. A chance to the visitors interact with the speakers.
The workshops are really meant to concentrate on methodologic issues that people can take with them to use in their own municipalities or their own countries. Traffic crashes and injuries and deaths are a major cause of morbidity and mortality in all nations around the world, particularly in low and middle income countries. So our goal is that people are aware of this important issues and therefore design their streets and neighborhoods to be friendly to vulnerable road users and ultimately to make streets safer for everybody.
With more than 20 different lectures, visitors seize the day of the conference and know that tomorrow will also be filled too.